So how do we do this? Lots of different components will go into a protocol. So when I'm sitting with a patient in my office, I'm thinking about those things. How is this patient's diet influencing their accelerated or decelerated aging process? What's happening with their weight? Where are we at with exercise? But very sort of basically, these are the tools that are available in my toolkit to help you to reverse or remove risk factors. So we want to support the detoxification ability of the body. We use nutrition, exercise, we optimize digestion, we limit exposures, that's mostly toxic exposures in our environment, help teach you tools to manage stress, make sure you're sleeping well, make sure you're hydrating well. We use acupuncture and the level laser at AcuBalance. When our clinic is open, we do those things. But at the end of the day, this last point is probably the most important: balance and moderation in all things. With everything that I'm going to talk about today, we always want to keep in mind that there's an 80-20 rule for everything that you do in the context of fertility. I don't want you to walk away from this talk and think that you have to eat perfectly every day, 100% of the time. There's always this room for balance and moderation. And yes, you can still, go out and have dessert when the world gets back to normal, or you can make yourself a treat every once in a while if you're staying at home right now, but it does not have to be. You shouldn't feel guilty about it, and you should not feel that that's setting you wildly out of balance. It's the things that we do consistently most of the time that make the biggest difference, not those small things that you do every once in a while that bring you joy, that sort of help you feel like you're living your best life. I want to still make sure that you know that you can do all of those things while you are working toward optimizing your fertility. So in the office, if you are to work with us sort of one-on-one as a patient at AcuBalance, these are some of the things that we do. We incorporate comprehensive functional medicine testing, again, to sort of determine why your body is not functioning at that end of the spectrum. That was vitality that we saw in that first slide. We talk about fertility diet. We do acupuncture. We use herbs. We use oral and IV micronutrient therapy, mind-body stress reduction, low-level laser. Some of these things you can do now with us in a telemedicine setting. So we are doing online consults right now with our patients, so we can more specifically use things like herbs and nutrients to support your fertility. So that this is available to you right now in a little bit of a limited capacity. But we can do most of these things over the phone. And we are going to get into sort of the lifestyle factors that you can influence now, but just so you know, this sort of one-on-one approach is also still available. So the big question is, can diet and lifestyle increase your odds of conceiving naturally or with IVF a healthy baby? And you shouldn't just take my word on this. So I'm going to show you some of the literature as to why I believe your diet and your lifestyle should be in the forefront of your mind with your fertility. So we're going to start with vitamin D. Vitamin D is a hormone. It acts like a hormone in our systems. It's a vitamin that acts like a hormone that I test almost every single patient, especially female patient who's trying to conceive. I test levels of vitamin D. And the reason why is there's some pretty good literature behind the use of vitamin D for optimizing your fertility. So we'll look at this Mount Sinai study, 173 patients. When they studied their vitamin D levels, this is women in this group, and they looked at vitamin D levels and just their natural fertility. So in per cycle rates, how often women fell pregnant, they found that women who had sufficient vitamin D levels had a significantly higher pregnancy rate per cycle. So about 52.5% of women got pregnant per cycle, compared with those whose level of vitamin D was inadequate or deficient, so 34.7%. What I find really interesting about this study is that's a pretty big difference. There's about a 20% difference in the per cycle pregnancy rate in the low group versus the adequate group. But they actually didn't even stratify in this study to look at an optimal level of vitamin D. So it would have been cool had they stratified the data that way, so we could have seen if there was even more benefit to that. There are a lot of reasons why vitamin D may be influential to you and your fertility. We've got some pretty good literature supporting a link between a vitamin D deficiency and irregular ovulatory patterns or having irregular cycles. So if you don't have a really predictable cycle, testing your vitamin D is a really good idea, or at least supplementing with a healthy amount of it. There's research to support a link between vitamin D deficiency and low AMH, vitamin D deficiency and insulin resistance. So that's specifically important we always talk about stabilizing blood sugar to help stabilize hormones in the context of fertility. And vitamin D, one of its main important roles is that it helps to mitigate chronic inflammation. So one of those things that sets that terrain out of balance. So we use a lot of vitamin D in our practice. I prefer to test it if I can, but in my opinion, every woman who's trying to conceive should be taking at least some vitamin D, and I would argue that men should as well. What other things do we know in the literature can influence your fertility or your chances of bringing home a healthy baby? Healthy fats are another really, really important one. And this study is really cool. There was a study done on walnut consumption. So they basically took 117 men who were between the ages of 21 and 35, and they just randomly assigned them. So these were men who were eating like a standard American diet. And the first group was told to avoid eating tree nuts altogether. And then the second group was told to consume 75 grams of walnuts per day, which are really high in polyunsaturated fatty acids. What they found, so they did like a study semen analysis on these men. Then they went and did the interventions for 12 weeks, which is 3 months. And then they did a post-test analysis on them as well. And they found that the men in the control group who were told to not eat any tree nuts had a reduced sperm concentration and more chromosomal defects in their sample at the end of the study than those who ate 75 grams of walnuts a day for 12 weeks. And they saw no significant changes in body weight or blood lipids. So they were able to control for that. Even though these men were adding an extra 75 grams of these healthy fats, they didn't weigh more or gain any extra fat during the cycle. So there's lots of research showing that your diet can influence the quality of sperm that you manufacture. Fats are also really important for female fertility as well. So there was one study that looked at trans fats and ovulatory fertility disorders. Crazy how significantly trans fats will influence your ovulatory pattern. Studies have shown that as low as 2% of your diet, if even just 2% of your diet comes from trans fats, 2% of your caloric intake, it more than doubles a woman's risk of having an ovulatory fertility disorder. So we do want to be really careful in your diet to pick really high quality fats and to avoid poor quality fats. Egg cells and sperm cells are really very sensitive to those things. Bit of research here for CoQ10. If you're trying to conceive, you probably know all about CoQ10. You're probably taking it right now. The very first study that was done on CoQ10, the reason that this nutrient is one of our first go-tos to help to improving sperm quality is that there's some really cool literature to back up influences of CoQ10. This first study was done in mice. And what they did was they took 52-week-old mice, which in mouse years, those are sort of aging, kind of close to perimenopausal age mice. Started giving them CoQ10, and they found that the eggs appeared to rejuvenate. So in the ovaries of these mice, they found more follicles, more mature eggs, and they actually had more pregnancies than a group of rats that was not given any CoQ10. The reason why CoQ10 is beneficial to your fertility is that it's supportive of mitochondrial function. Mitochondria in your follicles manufacture ATP, which supports healthy cellular development. So it's basically energy that fuels cell development. That's really important for egg cells. It's also hugely important for sperm cells. We know the sort of lengths and distances that sperm have to go in order to get to the egg cell. They are propelled forward bicellular ATP that comes from mitochondria in the midpiece. So CoQ10 has also been shown to improve sperm quality as well. So that's why we use CoQ10. A last little study here just to help convince you that healthy lifestyle changes can be beneficial to reduce cellular aging or reverse cellular aging. This study published in Lancet Oncology showed that healthy lifestyle changes can have an impact on aging and age-related diseases at a cellular level by increasing the length of telomeres. Telomeres are the caps on the ends of our chromosomes. They look basically like the plastic caps on shoelaces that prevent our DNA from unwinding over time. The older we get, the shorter those telomeres get, and more of our DNA is allowed to unwind, and it then becomes unusable, sort of signaling for cells to undergo apoptosis and die. This can happen in egg cells and sperm cells as well. Anything that we can do in our systems to help preserve the length of telomeres will influence the aging of all of our cells. And this study here suggesting that healthy lifestyle changes like taking on a healthy diet and exercising regularly and utilizing stress reduction can actually potentially increase the length of those telomeres. So the answer is yes. There's lots of things that you can do to optimize your fertility when you're trying to conceive naturally or with IVF, and this is the perfect time to focus on preconception. Give yourself those 90 to 100 days to really clean up the cellular environment and make it so that when you are then ready to try to conceive again, the likelihood of it being a really, really healthy baby is higher.